Hello, Professor. Today, can we answer some questions from our followers together?
Hello, of course, we're looking forward to all the questions.
Doctor, is cataract seen only in elderly people?
Of course not. We see it most often in the elderly, yes. But cataracts can be congenital or they can develop later due to trauma, certain diseases or medication use, so we can also see them in younger people.
So, doctor, is laser eye surgery permanent?
The success rate of laser eye surgery for myopia is 98 to 99%. For hyperopia, these rates are a bit lower. But in general, recurrence is not something we see very often. Very rarely, it depends on the individual's condition. It also depends on their habits in daily life. We can very rarely see recurrences as well.
So, doctor, can laser treatment be done on everyone?
It definitely cannot be done on everyone. First of all, there is an age limit for laser eligibility. The person must be over 18 years old. Secondly, the person's eye prescription must be stable. If you perform laser surgery while the eye prescription is still changing, you won't achieve good results. Therefore, the prescription must absolutely be stable. Apart from that, if you want to have laser eye surgery, your cornea must be suitable for the procedure. We actually map the cornea, and based on that map, if the cornea is not suitable, if it's too thin or there are other problems, then it's not appropriate for laser surgery. Apart from that, certain rheumatic diseases and pregnancy periods are also factors. In such cases, we do not perform laser surgery. Therefore, we absolutely need to conduct a thorough examination of our patient.
Thank you, doctor. Doctor, will there be any scarring after eyelid surgery?
With the eye, as with all procedures involving incisions, there is always a possibility of scarring. It is never zero. But with the eye, especially on the eyelid, this possibility is much lower. And especially since we make the eyelid incision along a natural crease, when we open our eyes and that crease falls inward, the scar is generally not noticeable from the outside, and over time, any minor mark usually fades away completely.